What kind of people could benefit from DFR?
Well, I mean, we've found benefits anywhere there's stiffness in the skin from head to toe. I mean, you can do it on your face, you can do it for TMJ headaches, you can use it for all kinds of shoulder dysfunctions and problems, coastal chondritis problems, sports injuries, ankle injuries, calf injuries, Achilles injuries, tendon injuries, nerve injuries, anything where the fascial tissue is not moving properly in the skin and the fascia impacts those particular joints and nerves and lymphatic tissue tremendously. And when you restore the health of that, you dramatically change how the fluids move through the tissues and how the nerves and the uh, tendons are able to move and glide and slide the way they should.
I had stage 4 tongue cancer, the base of the tongue. Each day was 2 radiation treatments while I was there, and chemo 24 hours a day. And they took out several lymph nodes afterwards.
Do you feel there?
Just pressure.
I'm pulling pretty hard here. And I'm going to switch direction.
Prickling, burning. It's really good. I could notice that I could really move a lot easier. In fact, I wondered myself how many people went through that and then lived with a real tight neck the rest of their life. And I thought, gosh, everybody should know about this.
I had a diagnosis of breast cancer a year ago in November, and then had surgery in December. Radiation didn't begin until the end of February. I was so fortunate to be able to come to you with the scar tissue that was developing after surgery. We got started on areas around the immediate tissue where I was even still getting radiation, but the shoulder and the arm and even back had already begun to become very restricted in movement.
When I actually showed you pictures of those adhesions,
Yes.
what did you think when you saw that?
Yeah. It was amazing. It was so odd to actually see something that I feel or try to visualize, and then to have sort of physical evidence, which is always helpful when you feel pain, to see a reason and to see how something is there that can be seen with the eye and that can actually be dissipated and broken up. See how what we're doing is actually working. I would love for more women to be able to experience the kind of healing along the way that I did and not wait. But I think that even if women have waited a longer time to get started, that there still is so much help available, and that there's no need to settle for the level of restriction in function or pain.
I'm able to hit a tennis ball, and I'm getting close to serving. In fact, when I played tennis recently, I just started serving. I didn't mean to, and then I just went into the serve and it was fine. I have waited several months to do that, and I've been swimming a few times a week.
Ulnar neuropathy, pinched nerve from a bad bike fit, numbness all through my left arm, extend my ring finger all the way, feel anything in my pinky finger, limited range of motion, and a lot of grip weakness too.
Do it as best you can. Hold right there, I'm going to lift up.
Sharp and warming?
Yeah. It feels like glue being pulled apart, or like a band-aid being slowly pulled off.
Yeah, that's really what we're doing. We're just ungluing it without creating more trauma.
Way sharper that way.
Have the warming there?
Mm-hmm.
So we're right where the ulnar nerve comes into the forearm.
Combination of sharp, pressure, and like shooting in my finger.
But what was it like before?
I couldn't even move the pinky with the single thin band, and now I can do it with the double wrapped thick band. I've been doing this all morning.
Needles and fingernail, and now it's just pressure. You see it's much, much stronger.
I had 8 sessions. Before I came here, I was banned from riding my bike, lifting weights, carrying dishes, carrying groceries, doing pretty much anything with my hand. I couldn't open doors very well. I couldn't really open jars, and I've been able to do daily tasks. I can open my door and jars and stuff.
And do the best you can to lift that leg up. And you're how many weeks now post total hip?
7.
7 weeks. And down. Yeah, and you can tell what's moving is the pelvis.
Yeah. Makes me move.
Not the hip really, it's the pelvis. Getting your back a good workout, isn't it? Yeah. The old quadratus lumborum's kicking in.
Yep.
This tensor is just as tight as a drum.
Mm-hmm.
And you're feeling the burning? Is that
Totally
right?
burning, yeah. It's totally just burning. Constant.
Okay, we did the first MRT session to the lateral hip muscles and tensor fascia, a little bit in the gluteus medius, and we're going to retest it here. And that was like not about 45 minutes ago.
Yeah.
And let it down.
That's amazing.
What are you feeling different when you do
Oh my gosh, I can feel movement here in this area of my hip. I had nothing before, so because this wouldn't move, I couldn't lift my leg. But now I have movement here. I can lift my leg.
that? Yeah, it's better.
It's a lot better.
So here's the incision, the top of it here. There's a lot of adhesion right in this gluteal muscle right here. What are you feeling there?
Burning. Yeah, a lot of burning. Finger, it feels like you're digging your fingernails.
What are you noticing?
You're gonna get me crying because it's just, I'm barely even limping. I'm only crying because I'm really happy.
How many times have we worked on you?
3. Yeah. Oh my gosh.
Look at that, you're not even holding on.
Oh, that's amazing. I definitely can feel a huge difference. Oh my gosh. That's really good. Yep. Totally different.
Beginning of July, I was diagnosed with breast cancer. A month later, I had a simple mastectomy. I'm 4 weeks post-op. Surprisingly, that more of my pain tended to be in the back area. Even though I had some pain here, I just think it was pulling me. I couldn't lift my arm to reach for a plate. Normal movements that you would expect to be able to do. It was very quickly, right after I couldn't move. Also knew that I should get in pretty quickly to get started on therapy. I've heard of the results, other therapists don't have any luck with. They know about adhesions, they know about myofascial release or trigger point stuff, but you only get temporary relief. The second session, it was 1 hour session, and my range of motion, immediately after the session, I knew I could move, even without doing it, but that day I could reach almost straight up where I couldn't before. After that second hour session, the numbness underneath my scar, I now have feeling there, and it was pretty itchy, and now I can feel that area. I'm thrilled with the results, and I want to continue, even through chemotherapy. I want to come in as often as I can. My desire is that everyone across the country could benefit from this, so that people would hear what I'm saying and that they would know I want to experience that benefit, and I will travel across the country to experience this, because it really, I've been so blown away by the results, and I feel like I can get back to normal life where before it just felt like I couldn't.
We're going to let this drop.
And you're totally relaxed?
Completely.
And if I push on it, I got some give in the hip and a little movement at the pelvis, but that's as far as that leg will drop. And you're totally relaxed?
Uh-huh.
And I push on it, and I can't push it down.
What do you feel there, Tracy?
Burning.
What do you feel there?
Some burning. Now I can actually feel where it's, the stretching across the hip as it hangs there. Before it just felt like, I could lay there all day and the rope wasn't going to extend. Normally been close to the wall, and just leaning into the wall about like this would have been about it, and I would have, like I said, it felt like it was fused, like I couldn't move it. And it's absolutely amazing. It's like I've got a hinge on the side of my hip.
You're starting to feel normal again.
Yeah, it's beyond normal.
So it's been, what, 2 weeks? Did you say 2 or 3 since bad water?
was rear-ended. I was completely stopped. There were 3 other cars behind me that didn't stop. Tight. And I could hear it crackling in my neck.
That's not quite 40 degrees.
Yeah. Pins and needles.
And this way.
Not as bad.
There's bands that come out this way and then go up this way. Right here, it's really tight.
It's like a burn. It hurts, but it almost feels good.
Does that go into your arm at all?
Yeah, it does. Yeah.
The thumb?
The thumb. Oh my God. Oh.
See why you have trouble moving your neck? And we just measured about 74 degrees. How's that feel?
Fine. It doesn't hurt. It's amazing. When I drive a car and I have to look in the other lane, I'd have to move half my body. Now all I have to do is move my head. I don't feel like my shoulders are hunched in and my neck is crunched down and stuck in one position. I feel free.
I knew that the collision was going to happen because I saw my husband looking in the rearview mirror and he starts to swerve around, trying to pull around while we're stopped, the car's in front of us. So I knew that something was going to happen, so instinctively I turned my head to the left. So as I was looking around my shoulder, the collision happened. It feels like now that's been released, I didn't realize I wasn't able to put my head back. And now I know because it's going back further, but I feel all of this stretching now that I did not feel. Going up and down better, my arm range and shoulder both. Used to have trouble, feels totally strong up here, which I didn't. Wow, my head completely rolls around, feels better. But my shoulders feel so much better, it feels flatter. And my neck, I don't know, my neck feels so much better. First time, I'm like, wow, I can see back there.
When I was 15, I was in a horseback riding accident and hit the ground hard and was in a coma for a few days. Traumatic brain injury. I had whiplash, and I had another accident at the end of October. Big SUV ran into me. And I've had so many different kinds of therapy. Physical therapy, Pilates, massage, cranial sacral, acupuncture. With chiropractic visits, I probably had at least 50. And massage, I would say at least that many in the past year. Cranial sacral, maybe 20. PT, at least 30. And then I was here over the Christmas holidays.
Can you describe what you're feeling here?
Like a pinching, burning. You're right on. It feels like it's burning steak. The range of motion a lot better.
How long's it been since you felt like that?
Certainly since before my first accident. When I got back to Boulder, all my therapists said, wow, your posture is so much better. The effects have lasted. I'm sort of in shock. I just have so much more freedom of movement, and I have this inner feeling like I've been trapped and haven't been able to move in a normal way, and now I'm pretty much able to, and it's a wonderful feeling. I can get my chin to my chest now, which I haven't been able to do all year, and it doesn't hurt. And when I'm riding, my spine can move with the movement of the horse much better now. Horseback riding these days, it's not burning hardly at all. It's like a miracle.
A screen fell off the wall and onto my arm. It hit me in a couple of different places. And when I first came in, I was having continuous pain. And after probably just the first treatment, that continuous pain stopped. And since that time, the pain has virtually disappeared. And it's just wonderful.
You see some give. There's a little bit of restriction right in the middle there. As we go this way, it's actually got more give and elasticity. If we go in this direction, you can see that they pull together quite a bit more. And then if we go this way, those squares stay apart, so that's where it's really tight. What are you feeling there?
Little stings.
Those
little pins.
The main restriction right there. Now we perform some MRT treatments to the flexor surface of the forearm. We're retesting the elasticity. You can see in this direction where it didn't pull together before, we now have these squares starting to pull together. You get that S shape in the longitudinal line there. Big change that way.
I think it's amazing, it's wonderful, it's incredible. I have told my doctor I would like him to know more about it so that he could refer more people here. I think as people are aware what it is, as people experience it, it's just, it's incredible.
I fell on July 5th on my back on stairs. I got this crushing chest pain directly over my heart. It went back to my back and it went down my left arm, and I thought I was having a heart attack. I've had several EKGs. I've had my blood drawn 10, 12 times, and I've had an MRI of my heart, and I've had a brain scan, and they're all negative. Through the month of July, I had on a pain scale of 1 to 10, a 10, so I couldn't sleep.
To my back of my back.
And what are you feeling there?
Radiating right here.
It radiates
out.
around that area.
Radiates out.
Is this in the area where you were getting the heart pain?
Yes.
I'm going to check this for tightness. Just tell me what you're feeling when I put tension on this here.
Burning a little bit. Burning.
So have you been noticing like stiffness in your neck at all?
A lot. Especially since the fall. Constantly rubbing the left side of my neck with my...
Does that heart attack feel?
Yes. My range of motion's back. I no longer have pain down my left arm. Discomfort level is, I would say, normal. I feel like I'm the way I felt before I had my accident. No, I'm not taking anything for inflammation or pain. Went on a trip. We went around the world on a jet, covered 33,000 miles in 21 days.
Wow, and how did you do?
I did okay. My neck didn't bother me. No arm pain. I just think I'm good as new. Very glad I came for therapy. I don't think that I would be able to function if I had.
There you go, and then bring it back up. See, in these adhesions, a lot of these were there before the surgery. See the adhesion pretty clear right there. And it makes sense, you know, before you have the surgery, the toe is all in a valgus position, so this all gets shortened up and tight through here. Within an hour, what a change.
Thank you so much. It feels so much better.
You look pretty even.
It does?
Yeah. And back.
The past 5 years I've been trying to stretch out my hamstring on the right side. It feels like I'm stretching a cable. It stays sore for days after I end up doing a good workout. I can't get the leg over. And then as far as leaning forward, there's just no way.
Now we're just doing a dermal-fascial check of the posterior thigh over the hamstring on the right. And the upper part here isn't just too bad. As we work down to this central hamstring and the distal 1/3, it's really starting to tighten. And right in here, there's just no elastic quality left in that. And right here, it's real tight.
I feel that stinging feeling.
Stinging right there. And this whole thing draws all the way down to the back of the calf. See that skin, how tight it is?
I'd just be in pain all the time. No matter if I was stretched out, or if I just got done working out, or if I waited 3 days, right there it was always painful. It isn't though. It's normal.
Just did the second treatment of the hamstring.
It's going deep now. As I was telling the doctor earlier, I'm starting to pull things I haven't pulled before. This has been going on for 5 years.
Able to get over it?
Oh, yeah. That's stretching someplace I haven't hit before. There's just no... There's no pull. It's gone. It's just, it really is limitless now.
Right here is discomfort. To go up higher, which I can't because of the restriction, I definitely feel it here now. That I can really feel right up here, down on the right side of my leg, I can feel it. Since the rest of it has become more flexible, I can feel where it's not flexible. Whenever I've built up lactic acid, I've always, the left leg, left hamstring has worked it out faster than the right. Since Dr. Mettler worked on it, the right, they actually is almost fine, and the left is still really sore. It's been about 4 or 5 months since I've been able to get the right leg up even remotely as high as the left. Wow. Last week Dr. Metler performed the technique and I didn't have any pain here, and now the whole leg is able to. I'm not even used to going down this far. It's not at all painful here. I haven't been able to actually go down this far and touch. Really amazing.
Wrist pain, and I went to go see a physician. They started me on a therapy treatment, and I've been in and out of therapy, taking different types of medication, and been wearing splints from then up until this point. No, there was no relief with the treatment. Tingling and numbness goes throughout my fingers. It's constant throbbing through here, and at times it goes up through my arm and into my shoulder, and sometimes into my neck.
What would your daily average be?
Between 8 and 9.
8 and 9, and that's no relief.
No relief, just constant throbbing.
Constant throbbing. These are the splints that you're wearing, is that right? This right one, just squeeze as hard as you can. It was about 50. And relax, and that one's just short of 40. I just did a dermal-fascial release on the deltoid, biceps, and across the elbow anteriorly. And Diane's grip improved from 50 pounds on the left arm up to 75. You notice a big difference?
Because after I did the grip strength test, I didn't feel weak, and before when I did it I was shaking because it was pulling and hurting, but now I don't feel that way.
But to get
Is that 90?
I'm now 8.5 to 9 months post-op. I've been having to kind of offset practices to compensate for my inability to use my left shoulder as much as I can as my right. Well, therapy, of course, was strengthening, using bungee cords, weights, balls. I've done pretty much any method you could possibly imagine, and yet it's still not as strong as my right.
17.5 pounds. Just go ahead and try and do a lift there.
That's it.
Yeah, but yet it's just stuck like super glue in here. Good thing is once we break it loose, it should stay loose.
I just got off the table and did this the first time, and actually there's no pain. This is smooth, you know, and as you feel the bands of muscle kind of tightens roll over, but it's not. It's actually smooth. It feels pretty good.
This infraspinatus is what does that external rotation, the one that you were doing on your side there, with
Really?
the primary muscle for that particular motion.
So all deep burnings.
Burning again? Good, that's the fascia. Did about an hour's work on the posterior shoulder girdle.
That's amazing. I feel I can open the joint a lot more. I mean, I'm starting to get tired, but I couldn't even do one before.
It's at ease to open up and kind of hit those extreme positions without having to fight it, without extra pain, kind of definitely through the biceps tendon. It felt significantly easier than it has been, so thank you.
Here's the portal where they put the scope in. See some adhesions coming back into the infraspinatus. Kind of feel how knotted that is there. That's scar tissue.
Sharp nail, burning, and a little Velcro.
Needles and the burning sensation.
Now I can do things like unload the dishwasher, reach in higher places without pain or discomfort. And I can sleep on both sides. Whenever I need to sleep, I can sleep and I have no pain.
I was on my way to a commission in the United States Marine Corps. In about October that year, after going through the first increment of training in Quantico, Virginia, I blew out my shoulder on a pull-up bar.
It's right in here.
So you can see there is some elastic give in that direction. This direction here, it's very tight. This way it has more give. It draws tight right away, right there. So we'll put some tension on it this way. And you can see those squares stay pretty much rectangular in that direction. And as we stretch this way, they pull together a lot more. Pull this way, they turn into a diamond shape. The main restriction is this way.
Before the accident, I could do 20 with a kip. Now I can't do even 1 without extreme physical pain. I can't pull through the full repetition. I'll sit on the bar and get maybe halfway.
So it feels like an ice pick going in there. That scar tissue is really thick right over that biceps tendon. So they said they'd take you back if you could get physically in shape, huh?
Yep.
Even after 6 years. Not bad after 2 treatments, huh?
Not bad at all. Much better. Not as much tightness, virtually no pain.
In 6 years?
In 6 years.
Moves like. What do you feel there?
It feels like a little tight burning in the very middle of the scar there.
And how about if I go this way?
A little bit the same, but not as much as the other one.
And if I go straight?
Yeah, there's more of a burn there in the middle.
Are you right on it now?
Mm-mm.
Really?
No, I'm about a half inch below the scar.
Jeez.
You can't tell that, huh? It feels like I'm right on it.
Yeah, it feels like you're right on it. Well, that feels almost like fire, almost back to the cauterizing.
And I'm an inch below the scar.
Jeez.
See when you move your face around how that feels.
Yeah, not as tight.
It's not so glued down.
Right. Yeah, it's better.
A lot more movement happening there.
Right there, nothing too much, stretching a little bit.
And when I go this way.
Same, just some stretching. Little burn on the top right.
How's that feel?
Yeah, loose. Feels balanced.
So take your hand, just move that scar and see how that feels. Yeah, it's right there.
Okay. Yeah, there I feel it. Yeah, it's good. Wow.
I mean, I was basically moving my entire body. I couldn't look up. It was impossible. I mean, I would have to go like this and lean back. And I remember that one day, then when you worked on the scar that I have on my throat, that I was suddenly able to look up. The improvement was incredible. I mean, it was like it had really turned a corner for me. And then I knew, that this treatment works. And it I don't know what I've done without it.
Thyroid surgery done, ended up with a closed vocal cord on the right side, and she's had problems with swallowing and speaking.
First surgery on my thyroid because it paralyzed my right vocal cord in a closed position. It really got worse, much worse, because it was the second time that they went in the first incision. They've been in here twice.
So she's got a lot of scar tissue that's built up. You can see the spaghetti lines in the restriction all the way over to here, over to this incision right here. But then extends up into the suprahyoid area. The side is tight right here.
And what do you contribute to that?
That's the collagen.
What's that effect?
Yeah.
Is it burning?
Oh, honey, you don't know the half.
Performed about 5 of the MRT treatments to the anterior neck and throat area. And can you tell a little bit about some of the changes you're noticing?
Okay, some of the changes that I've noticed 2 weeks ago, I was at church and I hadn't been able to sing since I became ill. During service, my voice just came really, really strong and surprised me as well as a musician because she could even hear me. I've been able to sing since then. When I was singing at my original voice with good tone quality, so that really made me feel good.
Pain and pressure in the upper roof of my mouth and pain in my neck and then tightness in my jaw. I just thought it was all TMJ until came in here for the evaluation. He suggested I go see a doctor and see if I can't loosen everything up. And it's amazing after you worked on me, the difference between the 2 sides is unreal.
Tell me you feel some of that sharp stinging.
There, sting. I've had sinus problems from the time I was a little girl. It's unreal how much, I don't breathe this free unless it's like facial where it had a lot of steam. Gosh, I can't believe how good it is. Drug-free.
I fell on the right, right on my jaw. I don't know, 3 times a week or maybe every night where my head just feels just feel so tight and hurt so badly, and just,
Can you point to where you feel those sensations on your head?
Yeah, when it's hurting really badly, it hurts here on my eyes, and like this whole part right here hurts, and sometimes this half hurts, and like sometimes my neck will feel really stiff, just in that area.
Just go ahead and try to open your mouth in a range that's what you would call comfortable. About there?
That
one. The bad one right there. So that middle temporalis is very, very tight, and I expect a strong dermal-fascial restriction in the auriculotemporal fascia right here. In here, right there. Does that sting or?
Yeah, that's nice.
And it's tight in this direction as well, right there. Does that sting?
Yeah.
Check the auriculotemporal region as well as over the masseter and behind the mandible. These are all areas that create a lot of compression to the TM joint. It's been 2 weeks now since we've seen you. I just wanted you to tell me a little bit about how you've been feeling since we worked on your face and jaw area.
Well, I've been feeling a lot better. I haven't had any headaches at all. And I think I had maybe 1 or 2 times when my neck really hurt. And I realized usually when that happens, I had just an excruciating headache. And I didn't have one, so it was great.
And your teeth, are they fitting together like they were when you left?
Yeah.
And how are you chewing? Are you chewing better?
Yeah, a lot better. I don't notice my chewing anymore, or feel like I have to, rearrange my mouth or whatever to chew.
Great. Let's have you go ahead and open there as far as you can comfortably. And we just measured that at 41 millimeters. Can you do that one more time?
Maybe 3 or 4 years ago, rear-ended on a highway, and then about a year and a half later, working at a different job, is lifting the 4-person lift. That's when I just could barely move. It was in spasm so hard I couldn't get up and I couldn't walk. There's just a feeling down this leg now of always having the tightness, tingling. When it's flared, it's ridiculous pain. It's like the nerve pain. Working part-time, a lot because of my back. Like an 8-hour day is hard. It's really hard. I can get...
That's about as far as you can go.
Yeah, and even that's really hard. I start feeling it. It's just the nervy up there, the pulling in the back.
How long you been trying to stretch that?
I've been trying to stretch it since the last injury, so for the past year and a half.
I feel it in the top of my foot. I've tried everything. I mean, I've done exercise, I've tried rugs, I've tried heat, I've tried ice, I've tried massage. But it never occurred to me that it could be glued, anything that would ever talk about that.
Well, most of the time we think of adhesion, we think of it around a nerve root, affecting the deeper tissues. I personally think a lot of the reason why the muscles don't fire is because they have the adhesions.
Yeah.
And you release the adhesions, then the muscles fire. Then you can re-educate it a lot easier.
The muscle's active now.
Now they're
it's
able to
doing
shorten
it. And it's never done it. So it kind of feels like that. Huh. Wow.
If we release this, you wouldn't feel like you'd be able to even sit like that?
No, because I can barely sit. I would never have done that.
Okay, now we've released over the piriformis and gluteus medius and we're retesting the 90-90. So this is the 3rd treatment session.
Because it used to be with a drop, a lot. Wow. Yeah, I couldn't do one before. I have to think about, I can just kind of do it. Didn't have enough movement.
That's right.
Yeah, wow. Yeah, I wasn't rotating before. I could go to about, this is where I could go before when I would do this.
Yeah, your brain remembers, doesn't it?
Yeah, I go here because that's right where I need to get the rotation.
Uh-huh.
And then I can get down. It's just real tired. I couldn't get down coming up and switching.
Yeah.
I couldn't do at all.
This is our 8th treatment session and we're going to retest the 90-90 leg position. Go ahead and try and straighten it.
The accident had occurred in January, and by September I had been through 2 therapy programs. One included a work conditioning program as well as 2 steroid injections. I really did not respond in a positive manner to either of those. I couldn't even carry a gallon of milk. My grandparents were here helping me to be able to go to the grocery store. I couldn't carry anything. I could barely, when I came for my initial evaluation, I couldn't even sit for more than 5 minutes.
This just kind of keeps your trunk in more of a flexed posture when this is tight. You know how you said when you were trying to bend backwards and it bothered you? I think that's why.
Okay.
So it's being restricted so much.
Because I would explain why it was so icky all through there.
Sensitive because when it's that tight, the blood flow is reduced so much that there's lots of waste products that get trapped in there. I think we figured out why this is injured. She said she was bracing her arms, holding them real straight on the steering wheel when she got hit. And that strains the serratus anterior, which is right here. Because that goes to the scapula, and that would have been eccentrically torn.
Oh, I haven't been able to bend over this far, and I don't know how. I feel like all this new movement.
Yeah, bending
I haven't been. This is the furthest I've been able to bend back since the accident. I mean, look at that. Yeah. Whereas yesterday, or even this morning, it was like right here. I mean, I'm just so close to being able to attain the level that I was at before the accident. I tried to get this job a year ago before I doubt that I'd even be qualified due to the physical demands, and even the sitting that would be involved with trying to have a job such as that.
Yeah, the pain was always on the outside, upper lateral side. You squat down and there's just nothing. Well, I've had pain since high school. I mean, it's been 5 years. I couldn't even do a unilateral squat.
Can you do it now?
I sure can. Not even an ounce of pain. I'm seeing the muscle work more than it ever has, physically, just looking at it.
And how much time do we spend treating that?
It wasn't more than 8 minutes.
Skating, I fell on my knee and hurt it. They found nothing wrong, no internal derangement, but I had a lot of pain here. It took me a long time to walk again, especially walking up slopes. I had to walk backwards. I couldn't run because my knee would ache and then my hip would ache.
So you've never really been able to run since this happened?
No, not at all. I mean, I try, but it aches really after.
It's been 3 years.
3 years. Before that, I could jog and I biked extensively. I had no problems with my knee, ever. Right. So I did limit how I skated, and it was very slow because I was so afraid to fall again. But no, I've not been able to jog or to even do lots of aerobic exercise or to jump.
Oh, you're right. It is really hot.
And it feels hot, and if I come back this way, that should ease a little. Was that right?
Yeah. 8? I haven't done 8 in ages. So there's another exercise I do, which I've had trouble. And that one I always have trouble with. And now I have no trouble. And I've always been able to do it really easily.
What would you have trouble with? What part of that exercise?
Balance. I always fall over.
Let's try one arm.
Okay.
Remember, I couldn't do this before. 63. 3 MRT treatments as of last week.
Well, a great improvement. When I went home after the treatment, just as I got to the door, I heard the phone ring, and I actually ran up the stairs 2 at a time, which I couldn't have done before. But on Saturday night, I went dancing, which I did for 3 hours, which I have not done in 10 years, and I had no problem, no pain at all.
I made a move that I'd made many times before, and I injured something in my groin because I was very tight. So after this latest injury 1 year ago, I started going to the local medical center and doing conventional kinds of physical therapy, and I kept getting worse and worse and worse. By the summer, I really couldn't get around. I could walk to the bathroom, but only very painfully, and I could be up for just, a very, very limited amount of time, to the point where I was going to the bathroom in a bottle in my office. I would go in for maybe an hour or two and do whatever I could, and then hope I could walk to my car with my steps would be like 6 inches long. The doctors just sort of gave up, and they said, well, we don't know what to do with you. Doctors kind of tend to suggest it's in your head when they don't know what's really wrong. But they suggested that I come over and see Paul Metler and see if he could do something for me, and Paul recognized that I had an awful lot of scar tissue.
Yeah, what's that?
Right there?
Yeah.
Yeah.
Oh.
Right there?
Yeah.
Yeah.
It feels like a bunch of nails. Oh, burns.
Feel it ripping?
Yeah. And we've been working together for the last 4 or 5 months, and he's been breaking it up, and it's very dramatic. I mean, it's taken a long time because I had a lot of scar tissue, but it's very dramatic in the sense that, you know, almost every session you can move something a lot more freely, a lot farther than you could before. So you see the results, you know, right away. And in my case, it's taken an especially long time because there was so much of it. It was so pervasive from so many years. I really haven't moved normally in over 20 years. I started seeing Paul in the beginning, first part of August, and you know, I could hardly walk. And I told him I wanted to be able to teach by the end of August when school started, or I would have to go on disability, and my salary would go down by a factor of 2/3 and so on. And I really didn't want to do that. And he managed to get me in shape so I could do that. And we set another goal of making a trip to Japan. I've been invited to go to Japan, and I didn't think I could make the trip, but you know, I did, and I stopped off in Hawaii, and we had a nice time. And I'm approaching normal function now. It's really worth it. I mean, there's nothing else that can release that kind of restriction and allow you to move again. I have a son who loves to play basketball, like my little boy, and go to the basketball practice, and I haven't been much of a father to him for the last year because of all this injury and so on, and this is his wildest dream, so he's going to have a wonderful Christmas.
A car accident a year and a half ago, tore my patella tendon and shattered half my kneecap off. I can't.
Okay. When was your accident?
A year and a half ago. I am putting all my weight on my left foot. It just feels like it could all of a sudden just snap.
Now we're going to do a dermal-fascial evaluation of the knee. Just doing tension testing. In this direction it's doing pretty good. This direction diagonally, it's not just too bad. Go diagonally. There's a restriction going across here, and get right into this area of scar tissue right in here. It doesn't give at all. Look right there. And down here it's tight right here too, and right here. But this way it is. Right there. This way it's really tight right here. That tight connective tissue would drive the patella right down onto the femoral condyle. Create a lot of pain. Now we have a nice elastic springy movement. How's that feel, Squat?
Cool. I did a lot of really huge hikes in Switzerland. I didn't have any problem hiking at all. And I can stay up on a bike now, which is thrilling. And everything's pretty good right now.
Complete knee replacement. The pain stayed there. Well, it's still there. I still have a lot of pain in the knee. The more I use it, the worse it gets. Can't do a whole lot of activity. I did rub a hole in one of my jeans through this 8-month, 9-month deal here. Yeah, right above them, well, right in that area. Just rubbed the hole completely through the blue jeans. That's about it. Oh, that's really holes right through here. Yeah, that's about it.
You can see where it fills in first.
Oh, yeah.
So now we're going to test this for scar tissue. And Pat, just tell me what you're feeling as I work my way through here, okay?
Okay.
Let's see, about right in here. What do you feel?
Yeah, that pinches.
That's a pinch? Fingernail?
Yep. I get my whole hand underneath it as close as I can get to getting it flat.
You've been trying to get it flat for 6 months.
Right. I've been here 3 times and I can't get my one finger underneath it now. Before it was, I could be that as far as I could get it. Big difference. Yeah, this ain't been able to do that for 6 months.
Can you go all the way down?
Yeah, that's the first time I got that far down. Actually picking something up off the floor, I can do that without going down my right knee. I ain't wore out another pair yet.
And then up. Yeah.
I do that. I do that. I wouldn't have attempted this before.
On March the 2nd, I fell on the ice and I broke my left elbow. As a result of the trauma to the system, within 2 to 3 weeks after the injury, I was diagnosed as having reflex sympathetic dystrophy. I started with physical therapy and occupational therapy right away. I had occupational therapy like 5 times a week and physical therapy twice a week. I saw a pain management specialist, a number of blocks equaling somewhere between 25 and 30 various blocks. Also saw another hand specialist in Indianapolis and in Louisville who had the same things to say and had a cervical epidural. When the catheter was removed, the pain returned. Hand gets discolored, but there is pain, and I'm very limited still with my motion. This is my fist.
And then try the hooking fingers like this. That's as far as you can get. Right there you can see the tightness going all the way across there. 1 MRT treatment.
The difference is the fact I couldn't go down that far earlier. Through here, it just isn't as tight. I mean, I couldn't do that. I mean, it's just amazing. Now I've got movement in them, and I didn't have any of that before. It almost feels funny because it's been so long since, you know, I have, because there's always been, it just seems like something here and here that was just pulling them back. But when I'm doing it, I can feel, I mean, I really feel it through here.
For the last 3 years, up until recently, I'd been battling some just chronic back problems. I got to the point where it was really preventing me from doing anything physical, and I had come from a place of being very active, doing triathlons and just swimming and always doing active things, to the point where I couldn't do anything without having a flare up or, you know, just chronic pain. Trouble riding the train, you know, in the mornings when I would wake up, it would feel like I had been beaten up, you know, in the middle of the night by a baseball bat. I tried some other physical therapists and some other techniques, and just really couldn't get it under control or really had any effect.
How about that way?
Yeah, I can feel it.
Mm-hmm.
Definitely feel that.
Stronger this one.
Mm-hmm. That one's radiating sort of up my back and down.
I think I was told from the beginning that there'll be some ups and downs through that, which I did feel a few of those in the beginning, but overall it's been kind of a slowly, steady upward sort of improvement. Whereas before I couldn't sit in the car for a half hour. This weekend I did an outdoor trip, and I was in the car for 3 hours, and then I was out sitting in the woods for 3-4 plus hours a day for a couple of days, and then doing the same thing back. And while I did have some pain and soreness that I typically have, it was so much minimized.
Starting last April and May, I had started having severe pain, burning sensations in my upper neck and upper shoulder going all the way down beyond the shoulder blade. I saw 2 doctors, neither of which could give me help. Went through their physical therapy program, which got no relief from, saw a chiropractor, which gave me momentarily relief. I'm here because none of them have been able to help. And it burns, it throbs, it's just constant pain. It doesn't ever go away. It goes down the arm too and into the 3 fingers on the end of the hand. This way, I can only get there.
And you've had that pain for how long?
Since last April.
And then up.
Hasn't been able to do anything. I can actually use my hair dryer in my left hand. That's been wonderful.
What are some of the activities you're finding yourself doing now that you weren't able to do 2 weeks ago?
I'm sewing.
Are you sewing now?
I've hung wallpaper yesterday, and I haven't done that in a long time. Once that muscle was relaxed, or you got rid of the knot, whatever it was, it's gone. I think it's great. I think you should train everybody in the USA.
So this is how far I can do with like my left hand, and I don't know. I can't really go.
When I go this way, what do you feel?
Doesn't hurt as much. A little bit of heat too.
When it's white, it pinches. When it gets pink, it burns.
Exactly.
Yeah, we haven't worked on this yet, have we?
Uh-uh.
If we hadn't done this, swimming would have been really hard at camp too. Coming this way, it's sharper. That is so much farther. I'm not like limited by anymore. Pretty much where my left arm is. This summer I'm going to be a camp counselor and I'm going to have to teach swimming, and I was pretty worried that I wouldn't be able to move my shoulder, but after, you know, just a few sessions I can move my right arm as well as I can move my left for like water stuff. Yeah, this is shocking to me. I can't believe this. I didn't think I was going to be able to do this. Yeah, like breaststroke too, just bringing my arms out and if I have to back. This is unbelievable.
And now try with the other one. No problem. Once more with the right. This is 7 weeks out. And down. And up. And what was it, like 3 weeks ago you couldn't do that?
Yeah, 3 of those flat, it wouldn't go.
And lift up?
I said go, it just didn't go.
The area in my heel, I'm feeling the pain when I'm walking, and it's a sharp pain. There's no bone spur in there now because they took it out when they did my ankle. Still in this, I don't feel the pain in the heel. I noticed that I could walk around my home without the brace. Went out to lunch wearing normal footwear and walked, and it was perfectly fine. And then the next day, just fine. I didn't have pain. I didn't have to take any Tylenol, and I was quite pleased. Also, my friend and husband noticed that I was.
And we've been working on that scar tissue around the heel and the lower part where the scar was.
Yes, and it seemed to be fine. I didn't have any problem with that.
I actually do a skin roll test, and I'll just pick it up. And if I look at it from this side, there's a little indentation going down towards the body to the side. All this is pulled down.
Now we found the dermal-fascial densification over the scar here. It's a transverse restriction. And what are you feeling there, Ann?
Burning sensation.
And if I come back this way, and when I go to that extreme?
That's needles.
So the shearing, when I'm really getting into the stiffness and shearing, we're getting that sharp needly feeling. The skin restriction is freeing there. And then as we go back this way,
back to burning.
Burning. So this is more fascial, and it has a little more viscoelasticity that way. And then it's a little stiffer right here.
Yeah.
Is that a little bit sharp?
Yes.
So the skin restriction is this direction. So that's more superficial than the restriction here.
Yep. It's so much better. You resolve layers, you start feeling more the deeper, and other things start coming through.
That's true.
Whereas before it's like all matted together, and now you release the matting and the cobwebs.
Yeah.
And now it's like, oh, here's some the tougher tissue maybe.
Yeah, you can access it.
You can access it. I'm definitely feeling and seeing this differently than I did before, Paul, so thank you.
Oh my God. It was way ropey, and it actually moves under my fingers where it was just stuck right there.
You know, interesting, Paul, where you would do like a muscle test of the lower abs before and after, and see how much that would influence on their strength or stability.
Well, it's interesting because it actually feels like it's engaging more down at pyramidalis.
You're noticing like more fluid flow and movement?
Fluid flow, definitely smoother. Like when I just looked down at it, it used to look wavy. It doesn't look as adhesed or indented towards the bone.
And how long's it been that way?
40 years.
Maybe like a month.
Yeah, you can really see that it shakes even. It's just not stable at all.
No.
Okay.
Wow, you're not touching down. Good job, good job. Oh, wow.
Am I doing it?
You are doing it. This is what you've been practicing at skating?
On the ice, not off.
Yes, let's see how it goes off the ice. Oh, wow, you're holding it. Oh my goodness, that's amazing.
I should do it the other way because you did this.
Okay, do it this.
How long ago did you have the injury?
Probably like 6 years
years ago. It's been kind of like a progressive injury here.
Yes.
Yep, same like right
Right on, where do you feel it?
all over.
Okay. Go ahead and do your lunge and tell me what you're feeling.
It really hurts when I'm at the very bottom. My knee is close to the ground. It hurts.
And where does it hurt?
Right here.
That doesn't have a lot of give to it. It's just very stiff here.
Yep, ow. Yep, that's the worst.
So this whole medial knee really has quite a bit of stiff. I would expect that we're going to see probably some redness up in this area here. And there it's stiff right there. You look at the knee, it looks completely normal. It's incredible how stiff it is. We don't look at these very superficial tissues, the dermis and the loose connective tissue that becomes very stiff and impairs the circulation and causes a lot of pain. We're going to retest this, and you can see there's an elastic bounce and stretch in this direction, in this direction, in this direction.
I could only go like here before. Now I can go like almost all the way down. Yeah, it's way better. It feels way better. I'm good. Now the left one feels worse.